between the preschool age, primary school, there is a continuous assessment by the healthcare providers of children, of our children and their mental and physical development. If practitioners, whether it is public or private, find that there is a deficiency, then there is a referral mechanism. The referral mechanism may be 1, to a specialist at the QEH, or 2, to the specialists that we have at the Albert Cecil Graham Center, where we have services like physiotherapy, occupational therapy, the audiology, speech therapy. So it is a really holistic model of care that we have at the center. So it is not just about identification of a health problem or deficiency, but it's also about managing that problem. And that's what we do at AC Graham. The concern is, yes, as Minister has talked about, the capacity and also the integration of not only the clinical and medical management, but the education, because it can't only be, health is not only about clinical management, it is about being able to manage at home, being able to manage at school, what you do after you leave school. So it is about integration into society and being able to play a role in society. So all of that is what we are looking at and trying to manage within the Albert Cecil Graham, and obviously with our partners in education, with our partners in the disability unit, with our partners at QEH, and that is really our goal.
Okay. Madam Chair, just one supplementary, if I may. Minister, you, in your opening, spoke about the aspect of wellness as part of your ministry, and of course, that is a key strategy because it is more economical to promote health and wellness from the start rather than to have to treat diseases. Better to be proactive and preventative in our treating towards health care of our citizens. And I was wondering if you could use this opportunity to speak more in terms of what the promotion of wellness in your ministry means for the people of Barbados, both in real terms and in terms of economics.
Thank you. Wellness is vital to what we are doing. And the people of Barbados will get to understand this as we go on. But let me say, first of all, that there are components of wellness that are already articulated in our program budget document. And you would recognize, for example, that there has been a significant increase in terms of the money that's being allocated to primary health care. And that is because the Barbados Labour Party has always preached the notion that primary health care, community health care, that must be at the forefront of what we are delivering. And obviously, I believe over the last few years, when you look at what has happened within the ministry, that we have neglected primary health care to some extent, in my view. And that is why we've decided this time around that we are going to place a lot of emphasis on the delivery of primary health care. Because if we do what we have to do at the primary level, at the community level, we should not be seeing the type and the quantity of urgent care cases that are finding their way to the Queen Elizabeth Hospital. And that is especially so for NCDs. And that is why we are committed to promoting healthcare within communities. And we've had some consultations with the Queen Elizabeth Hospital, for example, so that some of the nurses who have not passed the regional exam can be provided with a level of training that would facilitate their ability to go into communities and to do health checks and to speak to people within the community, residents, about health care. Because we strongly believe that each and every single Barbadian must take personal responsibility for their own health care. It has to start at the individual level, then at the community level and beyond. And that is why, for example, we have determined that all of our polyclinics are now wellness centers for the catchment areas that they are serving, and there are wellness activities that are being conducted at those polyclinics. We also have the National Task Force on Wellness right now doing monthly programs at parish level. I believe St. Lucie is this month, St. Peter is next month. And these activities, which will include not only physical activities, but we're looking at nutrition, we're looking at going into the schools and so on. And meeting, for example, today, this afternoon, with faith-based organizations, to be able to pull them into the mix as well, because this has to be an all-embracive and all-inclusive policy where we tackle it at all levels within society. And so there's a strong effort on the part of the Ministry of Health and Wellness to promote wellness in Barbados in all of its dimensions.
Just to remind members that all three questions need to be related. Let's move on to the Honourable Member for Christchurch West.
Thank you very much, Madam Chair. First, let me congratulate the Minister on the tremendous management that he is doing with the Ministry of Health. And it's obviously one of the biggest ministries, and he is obviously taken to it well, and he's doing an excellent job, and I commend him on that. My query has to do with procurement, and particularly procurement at the Queen Elizabeth Hospital. In a previous Parliament, I would have laid in this honourable chamber an invoice for a box of gloves at the Queen Elizabeth Hospital being double what a box of gloves would have been on the open market. It was, I remember, as double. And the next day, the Chief Executive Officer and the then Chairman of the Queen Elizabeth Hospital hastily called a press conference to refute what I was saying and called it false and incorrect. I would like to ask the current chairman of the Queen Elizabeth Hospital, what investigations are they going into to find out if the procurement practices at the Queen Elizabeth Hospital are in fact up to date and accurate? And is it that the cost of a box of gloves at the Queen Elizabeth Hospital is still double what it would be on the open market today?
Madam Chair. Yes, Madam Chair. Thank you, Honourable Minister, for that very important question. The issue
Now, we all know you, but still
yes,
introduce yourself,
thank
please.
You.
Thanks.
Thank you very much. Juliet Bino Sutherland, Chairperson of the Board of Queen Elizabeth Hospital. Thank you, and it's an honor to be here this afternoon to support the Minister of Health, who's really given very strategic guidance, particularly in the area of procurement management at the hospital. The Honourable Minister is correct that the issue of procurement has been a very vexed question for the Queen Elizabeth Hospital for many years. And as a result, on assuming the role of the chairperson, together with a very distinguished board, we established that this was an area that we were going to give priority focus to. As a result, we recognized it was important to bring some measure of control to what we found to be a rather chaotic situation within the procurement department, and we immediately proceeded to bring the procurement function as it needed to be under the control of the Department of Finance. In most organizations, procurement is a critical function, sub-function, and inventory inventory and control management of the finance department, so we immediately took steps to correct this measure. The minister is also correct that we recognize that some of the challenges existed with the procurement of goods and services. Not only do we have the challenges of getting supplies properly to the staff in need of it, we also have problems with pricing and acquiring items at competitive rates. So we immediately took steps to tender for all, not just goods and supplies such as described by the minister, all of the areas of the hospital that we could tender to ensure that for the Barbadian public we were providing the best possible price and the most competitive rates to be able to properly utilize the resources of Barbados. We recognize, however, that we also had to go further. As good stewards of the finances of the hospital, we also proceeded to recognize that we needed to provide some support to the procurement department, and we have engaged a consultant who will be working in the Ministry of Finance to re-engineer the procurement department and the business processes. And we've also recognized that there may be areas of significant challenges with the items that we're purchasing at the hospital. In this regard, we've identified the need to undertake a forensic audit of the procurement function of the hospital, and in consultation with the Honorable Prime Minister, we've identified a local firm who is best placed to assist us in this regard, because we recognize in relation to purchases that have been undertaken over time, there may be issues that are deep-seated systemic inefficiencies, but we also recognize that there may be activities that are more nefarious in nature. So in this regard, we've recognized that auditing and really holding persons accountable for the procurement function of the hospital is a critical activity that as a board we are engaging in. We also recognize that in terms of the procurement function, the issue raised by the minister is critical, because on a day-to-day basis, team members across the hospital indicate that they are not able to get basic supplies to do the work that they need to do. So we recognize it's not just a matter of pricing and getting inventory into the hospital, or internal systems of distributing goods and services across the hospital are extremely inefficient. So part of re-engineering the business processes of the hospital will be towards identifying how we can use technology more effectively to provide a better connection between the need for a particular test or the need for a particular item that the staff member is using, and getting it actually on time in the place that it is needed. So those are just the range of activities that we're doing to arrest the kinds of issues that the Honorable Minister, the member for Christchurch West, has so ably described as a deeply troubling to the board, some of the measures that we have taken to address it.
Thank you, Madam Chair, and thank you, Chairperson. A very diplomatic answer for a question that most people in this Parliament would call teething that was going on at the hospital, and this is the Parliament of Barbados, and I have to be truthful. I can't tell lies to the Parliament of Barbados. But clearly, this is obviously the reason why the hospital costs so much to run, because you've had a significant procurement problem. And I'll give you a question. I don't remember the name of the company. I think it was called Biomed. I investigated that company and found that there were 2 employees, but they were doing millions of dollars of work or procurement with the hospital. And I'm asking the chairman now, are you familiar with this company, and is this company still doing procurement and procuring goods and services for the Queen Elizabeth Hospital?
Yes, we are familiar with the company Biomed, and we've taken steps as part of our audit process. The chair of our audit committee, Ms. Sharon Christie, has been systematically looking at, with her committee, not just at this company, but other companies that are doing business with the hospital. Part of what we recognize is some of those companies are overseas based, and we, in consultation with the Consul General in Miami, have identified a U.S.-based attorney at law that we are intending to engage to look at the issue of look behind the corporate veil of these companies and identify more about who the directors are and be in a better position to report to this, for our minister to report to this honorable parliament about the nature of these companies and the businesses we have been doing with them over the years. So that is a work in progress, honorable member for Christchurch West, but I want to give you the assurance that we're leaving no stone unturned as a board of management to address these issues. The public of Barbados is very concerned. We've asked the people of Barbados to invest more in the Queen Elizabeth Hospital, and to whom much is given, much is expected. So as a result, we will be taking these matters very seriously and holding persons, organizations accountable where they need to be, and this company and others will be the subject of queries.
Final question is to the Chief Executive Officer, and I want to ask him if he was aware of the issues with Biomed, what due diligence was done on Biomed, and if he has any association with Biomed.
Thank you, Madam Chair. There are two companies that I know of, Biomedical International and Biomedical Unlimited. Biomedical International, we know, is a company that has provided support for many of the islands in the supply of equipment such as anesthetic machines, vital sign monitors, basically critical care equipment. We've dealt with them for many years. I myself have dealt with them elsewhere. I have no direct or indirect interest more than just the arm's length relationship between the Queen Elizabeth Hospital and Biomedical International. We do in fact our due diligence, and when on occasion we found out that we find for any one of the companies that we deal with that whether it be solvency issues, whether they be issues relating to the relationships with the major manufacturers of equipment, we discontinue arrangements with those companies. Biomedical International, we've been told by their representative that they are no longer representing this particular company in the region, and therefore we've discontinued our relationship with them. And most of these companies have affiliate relationships with manufacturers in the United States. And when on occasion we advise, we then take the appropriate action. Biomedical Unlimited is a supplier of medical equipment as well. They supply us with headboards for medical gases. They supply us with other types of medical equipment. They too, we have done our due diligence and found them to be credible. We know that they supply medical equipment to many islands across the region. And as of to date, we have no reason to have concerns with respect to their performance. Those are the two companies I am aware of in terms of the biomedical. Yes.
Madam Chair, let me say that the whole question of procurement must not be seen in isolation. As I said in my introductory remarks, our focus for this financial year in the Ministry of Health and Wellness is about restoring and enhancing operational effectiveness and efficiencies, and this is part of that process. So that by next week, for example, we have a team that is going to St. Lucia to the OECS to look at ways and means of collaborating with them with their pharmaceutical program to see if we could benefit from such a collaboration through economies of scale that will reduce the budget for pharmaceuticals that we currently have. So it's just part of the entire process.
Thank you. Honourable Member for St. George North.
Chair, I would like first of all to thank the Minister and his team who so far have been very frank with us. I must say that I have observed that there's a new direction and that the minister, who is well known for his punctuality, well known for his frankness and uprightness, have brought good change to this department. I must say from the outset, Minister, that the cost of health care keep going up for the average person, especially non-CARICOM nationals. There are many persons who live here, they're not documented, but find it very difficult to get any form of health care. And I think that one of the things, for the wellness society, you need to protect those persons in our society who are not documented and find some form of health care for them. There's still the question in the polyclinics in terms of opening hours. I noticed at the Glebe, for example, the hours are not, some mornings they go there, people go there and have to wait outside of the bus pole for a long time in order to get access to health care. But I want to ask what is happening at the polyclinic, at the QEH, as far as the physiotherapy department is concerned. Many persons still believe that the appointment times are too long and not frequent enough, where a number of persons can't get back to the normal way of life. I want to ask the minister, the team, what is really being done to strengthen that department to ensure that persons get the necessary treatment. And there are many people who are worried, doctors especially, and many families are worried about what is happening there. So we have a lot of concerns about this department. The other question is dental health. I think at the primary level especially, so many young persons find it difficult to access the dental health care that used to be. There used to be a time where persons can get dental care at the polyclinic level. I want to find out what is really happening there.
Thank you, Honourable Member. I will allow the Queen Elizabeth Hospital representatives to deal with the QEH issue, but let me start by addressing the first point that you raised and to make it quite clear to all and sundry that the Ministry of Health and Wellness, that we make every effort in the ministry to provide health care at the primary level, in particular to all persons who are residing in Barbados, without cost. There have been challenges from time to time, and I'm going to address those challenges shortly, because I can tell you that the government of Barbados is firmly of the view, and we have agreed, and the Prime Minister has directed that some legislation be amended to deal with the whole question of contingent rights and the liability to CARICOM nationals. But even before that, this ministry was providing health care at the primary level to non-nationals in this country, because it is not prudent to deny health care to all who are here and then allow someone to be able to present with a public health issue that can put this nation at risk. So that is the policy of the ministry. But once we have passed the hurdle with the contingent rights, we will send some formal instructions to all polyclinics in this country and to the hospitals with directions that such persons are to be provided with the level of health care that the ministry intends to. The dental health issue, I will leave it before the QAH. From the time I assumed office as Minister of Health and Wellness, this is an area that has been of great concern to me. It really is of great concern. And in chatting with the senior dental officer, I recognize the fact that the program, yes, has been facing some challenges for a number of years, largely as a result of the decline in the number of dental auxiliaries. We've gone from about 16 or 17 down to 6, with 2 persons due for retirement. And this has resulted from the fact that the course which used to be offered in Jamaica is no longer offered, and so we've been struggling. We've reduced the clinics to a couple that provide the service to the schools, and we've even been doing a bit of outsourcing. But I can say to you, Honourable Member, that the government of Barbados is intent on dealing with this issue, not only in terms of the provision of dental care, but making dental services part of our quest of having Barbados being established as a medical and educational hub in this region. And so we will be addressing this problem shortly. And so I now hand over to the chair of the QAH.
Yes, thank you. Honorable Member for St. George North, through the chair. Thank you very much for that question. The issue of waiting times, you raised the issue of waiting times for physiotherapy, but there's a broader issue of waiting times more generally for hernia and cataract surgery, waiting times for in the outpatient services department. Waiting times is an issue that has challenged the hospital significantly. The minister at his first meeting with us as a board, when he was charging us with issues of priorities to address, he quickly established or firmly established that this was an area he wanted us to tackle and tackle it as a lead priority in terms of what we do. I think we recognize that the issue of waiting times across the hospital is a function of some of the inefficiencies that exist within the hospital, and is also a function of the load of demand for services, certainly in all of the areas that we are challenged in. We recognize that we have to approach these issues in a number of different ways. We have to, in the case of outpatient services, really use ICT much more effectively to ensure that we are able to capture and effectively give people shorter appointment times. We also have to manage how people come into the hospital through the outpatient format. Specifically in relation to the physiotherapy department, unfortunately, the demand for physiotherapy services, in my view, way outstrips the ability of the department to supply. So this is an area that we recognize we have to give additional resources in terms of manpower and equipment, and we're looking at that in terms of the strategic priorities. So people are waiting long in some of these areas, and we recognize and we're taking steps to address them. CEO, would you like to add?
Thank you, Madam Chair. The increase in accidents and violence that we've seen over the last 3-4 years place tremendous pressure on our rehabilitation services. Today in Barbados, we have in excess of 60 strokes per month. Many of those patients who present to the hospital present in a condition where they require rehabilitation services. So as our chair has indicated, we do not have enough physiotherapists to be able to provide the treatment on a real-time basis when these patients present to the hospital. We've had to recruit physiotherapists on a sessional arrangement just to be able to manage the patients on our dedicated stroke ward C10. But it is in fact true that there is a waiting time simply because the demand that is occasioned by the injuries from accidents and violence, together with the number of strokes that are presented to the hospital, pose a severe burden on the limited physiotherapy and physical therapy resources at the hospital. Our board is looking at trying to see if we could engage some additional sessions to certainly reduce the wait time, but it is a situation of just the sheer numbers that present from these two major conditions to the hospital.
Madam Chair, I believe, based on what I have observed over the last several months, and certainly the discussion here this morning, I am strongly of the view that there's a need for a rehabilitation center in Barbados because the Queen Elizabeth Hospital does not have the capacity to deal with this issue. And that is the direction that I will be recommending to the Ministry of Finance, Economic Affairs and Investments going forward as something that we can look at. And also, and charitable donors.
Yes, Madam. Can I have a follow-up question? My question here, if you say that you have a shortage of staff, what training do you provide? For example, I am of the view that the last administration did not provide enough training for nurses. In fact, nurses now have to train nurses now go before the stipend. And if you want to create an atmosphere in Barbados where you provide opportunities for persons not only to work in Barbados but abroad, for example, the Minister of Labour recently said that he wants to train nurses abroad. Why are you not providing that stipend to nurses? And why are you not training doctors into psychiatric training and all types of specialized training and providing that stipend for doctors as well as nurses?
I don't understand the question. Honourable Member, yes, we have an issue. I would say we have a nursing shortage. There's no question about that. And I recognize that. That's one of the issues that I recognize from early in my tenure, during my tenure. And I've sought every possible way to get to the bottom of the issue. And I am at the point now where I am quite sure where the difficulties are, having had some consultations with the people at CXC. We have a situation that's been going on for the last few years where we are graduating nurses by the community college, but the nurses have not been able to pass the regional examinations at the level that we expect. And there's a serious deficiency. In some cases, it's about 1/3 of a particular course. And I have the statistics for the last 5 or 6 years. I also requested and received information from CXC as to the areas where our nurses have been failing, and we are going to examine those closely and have some discussions with the Ministry of Education, and they are aware of this. Also, the Barbados Community College, the University of the West Indies, and the Barbados Nursing Association. And we are going to determine the best way forward in terms of remedying this situation. But I give you the assurance that this matter will be resolved during this coming year. As for the doctors and stipends, trained nurses used to get a stipend under the former Barbados Labour Party's administration. Are you going to provide that stipend once again for trained nurses? Well, first of all, it obviously was stopped because I'm not aware of it. And let me say to you that whatever we do, we must be cognizant of the fact that we are operating under a BERT program, a structural adjustment program, and so we have to manage within the confines of what is possible, and that is all I can say about that.
Honourable Member for St. John.
Thank you, Madam Chair. Honourable Minister, I want to localize my questions to St. John, and I have 3 questions related to the polyclinic. The first one is a major concern when I within the community, the constituency, about the fact that we have a well-equipped gym at the David Thompson Polyclinic that is really just lying there. No one is using the gym. Can you speak to me in relation to plans for that particular gym at the David Thompson Polyclinic?
Thank you, Honourable Member for St. John. My very first visit to the David Thompson Health Services Centre, the Polyclinic, I saw that gym and I thought it was a quite well-equipped gym. But I too was very alarmed at the fact that the gym was not being used. I inquired and I was told that the gym was supposed to have been used by the Heart and Stroke Foundation, and that has been so for a few years and nothing has happened. In my view, and I've said this to members of the staff of the ministry, as part of our wellness program and our wellness initiative, that this gym should be made available to the people of the community. And I give you the assurance that we will be having those discussions, and even if the Heart and Stroke Foundation wants to use the gym, and there's nothing wrong with that, there's absolutely no reason why it could not be shared.
Thank you, Minister. I really appreciate that. In your budget document 364, I'm seeing $36 million attached to care of the elderly. And my question, now we have a lot of persons who are unemployed in St. John. Is there any consideration to working in concert with any of the training institutions to localize care of the elderly program? Because I believe that, in every constituency, this demographic is growing. And I will welcome the initial program to be at the David Thompson as well. But that is the question. Is there any consideration to twinning with any of the institutions to doing care of the elderly programs?
Thank you. That's a very good question. And this is something that only the last week or two, the ministry has been engaging in along with the Queen Elizabeth Hospital. And they say that because we've had a problem that has been existing for a number of years, where about 35 elderly for care persons have been occupying beds at the QH. And it's, for the most part, it's because of the lack of space within the geriatric system. What we've done recently, and recognizing the fact that the government already provides the ministry with funds for 250 elderly for care patients at the within the alternative care program, and that we had some space there, we started the process of transferring patients from the geriatric hospital who can exist within the alternative care setting, and those who require hospitalization, for example, from the QAH, we've been now moving them. And I can say to you that up to this point, we've been able to move about 16 or 17 of those patients, and the intent is to move all 33 or 34. But we expect and intend to take this to another level. This government strongly believes, in this ministry agrees, that we need to be able to get our elderly patients to remain in the communities where they live and where they are familiar with. And one of the things I can tell you, certainly within my own constituency, the city of Bridgetown, I was surprised at the number of persons who had successfully completed care for the elderly programs. And it certainly would be cheaper, even if not getting persons within the household, but within the community who can take care of elderly persons with a stipend. It would certainly be better than what it is costing the government at the moment, because if you look at the programs that we have, it costs about $26,000 a month at the QEH for one elderly patient. Within the geriatric hospitals, it's about $5,500 a month. And for the alternate care for the elderly program, it comes down to about $27,000. If we go the route that you are suggesting, Minister, it will be far less than that. We would benefit in the ministry in terms of having more funds to do other things, and the elderly would benefit from being able to remain.
Sorry, please clarify. You said 27, but this is what figure is 2,700?
It says 26,000 at the QEH, about 5,500 in the geriatric hospital, and the alternate care program is about $2,600 to $2,700 a month. Okay. And I'm saying that if we do what the honourable member is suggesting, we would not only save funds that can then be redistributed to other areas within the health sector, but it would be more advantageous and beneficial for the elderly persons to remain within their homes and within their communities, surrounded by people that they know, and it would also provide some employment, temporary or otherwise, for members of the communities.
Thank you, Minister. Like I said, please remember that St. John should be the pilot for this program. My last question in relation to the polyclinics is attached to my neighbor, the AG. I've been looking in the documents and no funds have been allocated for the community clinic. And I know that he would want me to ask a question in terms of what is happening with the community clinic in St. Joseph.
When I came to the Ministry of Health and Wellness, the conversation that I was exposed to was about the closure of the outpatient clinic at St. Joseph. I had a discussion with the Member of Parliament for St. Joseph, and we agreed to conduct a site visit, and I did that with members of my team, along with the Member of Parliament for St. Joseph. When I saw the outpatient clinic, I certainly was not of the view that the clinic should be closed. It's a spacious clinic. They're doing some wonderful things there. It is in need of some refurbishment. There's no doubt about that. I believe that this project, that the clinic should remain open, and that we need to engage the private sector and community groups within that area to be able to do some of the things that are necessary to get that clinic up to the standard that we would like. But certainly for a government that has a vision of taking healthcare into the community, closing a community or outpatient clinic at this time for me is not desirable or acceptable. We just have to be innovative in the way we treat to it in terms of the refurbishment program, and that is what we are going to be doing.
Honorable Leader of the Opposition. A little longer.
Thank you, ma'am. Again, my next question would have been somewhat preempted by the honourable member of Christchurch West, but I'm going back there if only to put it on record. He referred to price of gloves. Now, my research tells me that between 20 and 40% of monies allocated to health care usually end up in wastage due to pilferage. Small item pilferage is not my concern today. There will always be somebody who will take a roll of toilet tissue or a bar of soap. My concern is corruption around the issue of contracts and arrangements relative to procurement. I was not altogether satisfied with the response of the chairman of the QEH board to the questions from my honorable friend from Christchurch West. I thought, too, she was rather diplomatic. But it bothers me that in a context, and the minister himself did submit a little while ago, that we are constrained, as we are, under the BERT program, and therefore prevented to some extent from making responses that we need to make in the face of the rising need for better capacity to respond to stroke and other misfortunes such as that. The admission has come that the facility is too small, that staff is short. It seems to me an immoral thing that we pay people subject to contracts put together in seemingly strange circumstances. I'm trying to be diplomatic in my language too, but the fact of the matter is, my understanding of what obtains in the Queen Elizabeth Hospital situation is that we now have a chief executive officer whose contract was put together in the dying days, literally dying days of the last administration, and that the financial arrangements attached to that contract are such that in the context of a BERT program where we're sending home people and where the hospital does not have the capacity to respond to demand in critical situations as physical therapy, strokes, etc., this is a situation that needs to be publicly ventilated. I'm simply asking, what is the hospital administrative board doing about that contract and any other contracts which may suggest similar infelicity?
Thank you very much, Honorable Leader of the Opposition, for again coming back to this important issue. The issue of contracts at the hospital has been an issue that we have been attempting to grapple with, first by establishing what contracts we have. The hospital does not currently have a functional contracts. Well, we found that there was no functional contracts register. So the ability, one of the first questions we sought to understand as a board is who has what contracts, what are the terms and conditions of the contracts, and we recognized right away that a basic accounting function and legal function did not exist. So you're correct, Honorable Leader of the Opposition, that the whole contracting practice and processes of the hospital have been deeply problematic. And we've had to address that because we're in the process of creating a contracts register where we can know do better contract management. Part of the issue, in my view, of why that situation, I used the word chaotic earlier, exists because what we found as a board is that there was a clear flouting of many of the procurement guidelines of the hospital. And as a board, because we've been tasked as a government, and certainly as a board, we've followed the principles to adhere to good governance and be fair and transparent in all that we do, we really have been in the process of ensuring that as a board during this tenure, we have put proper procurement guidelines in place. In fact, we are having a consultant engaged from the Ministry of Health really strengthen our training and capacity development of staff around procurement practices. Specifically in relation to the contract of the CEO, it is my understanding that this contract has been the subject of scrutiny by the officials within the broader legal framework of the government of Barbados, and we ourselves have looked at it, seeking to establish the validity of it. As we speak, we've engaged a local attorney to support us in the process of looking carefully at this contract, and until such time as he renders his recommendations to us, we are really awaiting his findings.
Thank you, ma'am. And I would only further say that we will await with bated breath the outcome of that. But these things concern me. Just before I came up these stairs, are the stairs honorable as well, ma'am? Just before I came up those honorable stairs this morning, a lady out of St. Michael West called me, who has an association with the QEH. I hear they're laying off 150 people from the hospital. Please ask if that is true. Those persons are concerned about their future, but they're concerned about their future in a context where what currently obtains is almost vulgar.
Can I speak to that? At present, it's unfortunate that perception is out there that we are laying off a very specific number of persons. But the reality is that as a hospital, we recognize that we have to do some staff rationalization. In terms of the demand for services at the hospital, we have a situation where the medical establishment, the number of doctors in various specialties within the hospital has not changed for over 30 years, yet the disease and epidemiological profile of the country has changed. So we have areas within the hospital where we are understaffed and under-resourced, and areas where we may be overstaffed and we can be better served in terms of being cost-effective with outsourcing the service, entering into public-private partnerships. There are lots of areas that we can look at critically to better manage the resources of the hospital. So we are going to have to undergo a very systematic exercise at looking critically at the staffing levels of the hospital, and we do anticipate that there will be give and take, increases and contraction in some areas, and we're going to do so in a responsible way. But I can say to you, Honorable Leader of the Opposition, there is no magic figure that is existing upon high that we have ventilated and we are planning to implement or inflict on the staffing of the hospital.
Thank you. Just finally, the chairperson of the hospital board really ought to be a politician.
Honorable member for St. Peter. Yes, you're here.
Thank you very much, Madam Chair. My question has to do with Program 360, and the sub-program is 408, and this is the Morris Bayer Polyclinic. And I just want to ask, I see the budget estimate for 2019-2020 at $6,024,000 versus a revised estimate 2018-19 of $2.4 million. Some of the increase has to do with statutory personal emoluments, so those are persons working, permanent staff working, a significant increase. And then there's some other increase in the non-statutory recurrent expenditure as well. My question to the Minister or the Permanent Secretary would be the increase. What is it for, and how does it impact the service? I see increases, so I'm assuming positive impact, but in what areas is there going to be change and an improvement in the service at the Morris Bayer Polyclinic based on this relatively significant increase in the estimate in this sub-program?
Good afternoon, Madam Chair. The significant increase in terms of the Morris Bayer sub-program, that is actually not, it was the same cost last year. What happened is we had the environmental health officers, they were dealt with under a separate account code. This year we've put them all under one, so it is actually consolidation, and that's why you see that jump all for all the polyclinics. So it's not that we've brought on additional bodies. It is just that we have changed the formatting of the presentation of the estimates, and that's why you are noticing that increase.
Okay, so then, so then the good feeling that I had just disappeared. My follow-up question then has to do with what is the ministry proposing to do to alleviate some of the waiting time? It was not the question that I intended to ask, because I thought the answer would have been that the increase had to do with improving the service. What is it that the ministry is intending to do? Because there are persons who are waiting inordinately long times to see doctors at the Morris Bayer Polyclinic. What is the ministry's plan to address that issue?
Thank you, Honourable Member. I will now ask the Chief Medical Officer to address this issue.
Some of our polyclinics across Barbados have extended hours, of which the Morris Bayer is one of those clinics that have extended hours. In addition to that, we have fast track, which goes to 10 o'clock. We believe as a ministry, from the technical perspective, that polyclinic services are critical because that's where they meet the people of Barbados so they can realize care. With respect to the waiting times, we are looking at reviewing our primary healthcare systems to make sure that they're actually fit for purpose, and that is ongoing. So when that process is complete, and we intend to complete that process fairly quickly, that issues surrounding waiting time and quality of care will be addressed head-on and improved. Karen?
Thank you, Madam Chair.
No, you got to go upstairs.
All right, thank you, Madam Chair. What I would like to say is that waiting times differ depending on the condition of the patient. So you may have one patient with a very short waiting time, and then you have another patient with a longer waiting time. We do a system that's called triaging in the polyclinics. So if you are what we call a walk-in patient, where you have walked in because you have a concern, you do not have an appointment, if you have an urgent matter, so if you have query what we think is a fracture, if you have chest pain, if you have abdominal pain, you will be seen faster than someone who maybe has had a rash for a week. So also if you have an appointment, you will be seen faster than a walk-in who has maybe more of a chronic condition. So wait times do differ depending on your condition. I would say again that wait times do differ from polyclinic to polyclinic because it depends on the staffing. If one day we are short on the nurses for triage, we don't have a doctor in, waiting times will be longer that day. I would also say to you that the waiting times depends on the service that you have come to attend at the polyclinic. So there are a variety of reasons why you may have to wait a bit longer, and the waiting time also depends on the day. If you come to the polyclinic on a Monday, because that is a heavy day for polyclinics, your waiting time will be longer than if maybe you came on a Wednesday or Thursday.
Honourable member for St. Lucie. You are.
Madam Chair, and let me certainly compliment my fellow minister, the honourable member for the city of Bridgetown, in a special way because his ministry is a very large one, similar to the one which I have the honor to work in, being transport and works, and so I can understand the various challenges from time to time that you would have in such a wide-ranging ministry. My question though, as I go to health and program 361, sub-program 0376, the emergency ambulance service. Now, as one representing a constituency very, at least the northernmost part of the island, you could well imagine the challenges some of my constituents have in relation to ambulance service. And my question, first of all, is rooted in is exactly if there are any plans to increase the number of ambulances in the ambulance service. We know we have the support of private agencies in this regard, but for a rural constituency like mine, we don't have the sort of funds that may be charged to take someone from St. Lucie to the Queen Elizabeth Hospital. So I'm wondering if there are any plans to look at the fleet of ambulances in terms of increase. That's my first question. I'll have a follow-up question.
Thank you, honourable member. The CEO of the QEH will speak to this, but I need to say this up front. One of the problem is not so much the number of ambulances that we currently have. The problem has to do, believe it or not, with accident and emergency and the QEH, and it's a domino effect. If there are no vacant beds in the wards at the QEH for people to transition from accident and emergency to, it means that they remain within the accident and emergency department. So that when ambulances come to the accident and emergency and people are delivered there on stretchers, the ambulances cannot utilize those stretchers if there are no beds for those persons. And that is what really causes the delay with the ambulances. We have a good complement of ambulances, I would suggest. The staff work very hard, and if the CEO gave you the statistics of in relation to the number of calls, then you would be surprised. Furthermore,
Minister, could you explain that one more time? I did not quite get it.
Yeah, I'm saying that even if we added another 5 ambulances to the fleet. Unless we solve the issue of beds at the QH, bed space, vacant beds, if the accident and emergency, the A&E department needs, I believe, about 23 or 24 beds per day to be able to transition patients from accident and emergency to the wards. If those beds are not available, it means that persons who should be in the ward have to remain in the beds that are at the accident and emergency department, which means people who come in by ambulance, for example, who cannot get a bed in A&E, they remain on the corridors, on the stretchers or trolleys. And so those ambulances then become ineffective, inoperable. They cannot be utilized really because they don't have those pieces of equipment, if you understand what I'm saying. So I will now ask the CEO of the QH to address the issue.
Thank you, Madam Chair. Currently, we have a fleet of 10 ambulances and 1 rapid response vehicle. We make an annual call responses, about 12,000 calls per year, of which 13% are trauma and the remaining 87% are non-trauma cases. We've utilized the Arch Hall facility predominantly to increase and improve response times towards in the west and north. And permit me to share with you, Madam Chair, what those times are. St. Lucie, from headquarters, it was 35 to 45 minutes. When we had the Arch Hall facility in operation, our response times were 20 to 30 minutes. St. Peter, 15 to 25 minutes. St. Andrew, 20 to 30 minutes. St. Philip, 35 to 40 minutes.
We're talking about provided you get an ambulance from the hospital to St. Philip, for instance?
No.
Drive time?
Madam Chair, this is when we had the from Arch Hall.
Oh, okay.
To cover the West Coast and the North.
Oh, I got it.
So compared to when the Arch Hall facility was inoperable, St. Lucie, for instance, was 35 to 45 minutes from headquarters. When we had Arch Hall in operation, it has dropped to 20 to 30 minutes per call. Provision has been made in this year's budget for the purchase of 1 additional ambulance. We believe that a fleet of between 11 and 12 is adequate to service the needs of the population of Barbados. But as the ministers have said, the numbers by themselves don't tell the story, because if there are problems in the accident and emergency department and we do not have beds to accommodate the ambulances, then the stretchers become utilized, and therefore that constrains our response times, and in fact constrains the entire ambulance services. So ideally, 11 ambulances would allow us the necessary preventative maintenance programs, and we believe based on the distribution of the call responses, we believe a fleet of 11 could adequately service the entire needs of the country.
So this will cut down the time to get to St. Philip by less than 2 hours, which is what it stands at now?
All right, so
by adding 1 ambulance?
So St. Philip, prior to the Arch Hall operation, was 30 to 40 minutes from headquarters. Once the Arch Hall operation is in effect, the call response is, well, if we had to move from Arch Hall, 35 to 45 minutes. Well, let me just say that.
Yes, please.
The challenge you would always have with any ambulance service is that if all 12 ambulances are attending to a call, when the 13th call comes in, somebody needs to make a call. And the dispatcher normally will, based on the algorithm, will decide which one of the calls we're going to abort to take up the 13th call. And invariably, that creates some problems, because we may be on a call to St. Philip and someone presents with a cardiac arrest, and that's the 13th call. We're going to have to give that a higher priority over perhaps a non-trauma type of call. So those are the challenges that we tend to have with respect to the ambulance fleet. It's not a question of the inadequacy of the fleet, but it is one of the nuances that exist in the emergency ambulance services, where once the number of calls exceeds the ambulance fleet, there's going to be some consideration for delays of one person.
Follow-up question, and well, I understand the explanations given in particular by the Honorable Minister, and then followed by the CEO. What about further decentralization? Because I recognize that almost in everything across Barbados, everything stops at St. Peter, but there's a parish beyond St. Peter, a constituency called St. Lucie, the only female name. And I am therefore putting in, I'm sent here to represent them, the good people of St. Lucie. So we have the district hospital there, and I'm not going to talk about hospitals, I'm talking about decentralization, a case for an ambulance centered at the district hospital, still feeding out into St. Peter and St. Andrew and those particular areas, because we have here, based on the times just given, that it could take 20 to 30 minutes coming from Arch Hall, which is now inoperable. And so we need to be, the people of St. Lucie need to have some sort of comfort in knowing that once they've called an ambulance, that it would be there and they're much quicker than because 20 minutes is a lot of time, and it has a big, nice space there at the St. Lucie District Hospital, which can accommodate about 2 or 3 even. So my question to you, decentralization, do we plan to decentralize anymore? And would St. Lucie be considered at any point in time? Or will St. Lucie now have not been considered at all at any point in time?
All right, Madam Chair. The deployment of ambulances is based on call responses, is based on data that gives us information about the likelihood of an accident or incidents in a particular area. So we track these calls over a period of time, and we have a good understanding about where the likelihood of an accident occurring in a particular locale. But having said that, I am aware that the Ministry of Health, in the 24-hour arrangement for the polyclinics, the intention is to have an ambulance station at the St. John Polyclinic, which will improve the response times to St. Lucie and the parishes in and around the area. The issue of decentralization has been spoken to, but it's not, we believe that decentralization is perhaps not the best option based on the call responses and the data that we have. Perhaps we will consider roving, which allows us to station an ambulance in an area where there's a likelihood that there's going to be an accident. And that is driven by our database, which gives us information about the accident profile. So roving is perhaps the option of choice. If at all we're going to spread the existing fleet to be able to improve response times. So for instance, if there's our data shows that there's a likelihood to be an accident to occur on the, let's say, Sir Garfield Sobers roundabout between the hours of maybe 6:30 and 9 o'clock, we will then send an ambulance in and around the area so that we could improve the response time. But as I said, the data that we have doesn't support roving at this point in time. It supports the decentralization to the Arch Hall Polyclinic, and certainly it will support the decentralization to the St. John's Polyclinic when it is open, so that we could improve response time in and around the area.
Well, my only other thing I can take it then that the people of St. Lucie are very healthy and therefore wouldn't take an ambulance, and we follow the wellness program. Thank you.
Thank you. Honourable Member for Christchurch West Central.
Thank you, Madam Chair. I want to commend the Minister foremost for trying to remedy the ills in the healthcare system. My question goes directly to the director of the Barbados Drug Service. If she can come forward, I would appreciate it, please. But in the meantime, looking at subheading 363 on the pharmaceutical program, we recognize that we are currently spending $10 million less than we had projected in the approved estimates of 2018-2019. And that may have a lot to do with the advancement of generic drugs and generic products on the formulary. My question to the director is, as I speak, we have a situation in Barbados where two generic drugs were taken off the formulary, namely valsartan and indapamide. My question to her is, why were these drugs removed? That's my first question, and she can answer that first, please. Why were these drugs removed? These drugs were bought in by a company called Ceron, an Indian company, but they were removed over the last couple of months from the Barbados Drug Service. I want to know from the director why these drugs were removed.
Thank you, Madam Chair. As part of the response to the first question with respect to the generic products, we did indicate that we do carry out due diligence. And what would have happened with valsartan by Ceron was that they tendered, we accepted, we asked them for samples to test, we sent the samples to the Caribbean Public Health Agency for testing. It failed the dissolution test. And at the same time, there were some due diligence by the United States Food and Drug Administration on the same valsartan, but by a different company. And I think that would have compounded and caused some problems, because even though the ones that the US FDA had issues with, we did not have them on our market. But it just coincided that from our due diligence and what was happening in the United States of America, the same drug was being, by two different manufacturers, was being questioned. And I would add that right now we are relooking that particular drug, because the issue was, when the lab did the testing, the lab tested for immediate release of the drug. And it was not the fault of the lab, because the manufacturer did not indicate that the drug was sustained release. So therefore, the test was done as a general ordinary drug. But now that they've indicated, and both parties have identified where the challenges could have been, we are retesting that product with the correct information from the manufacturer with respect to testing them for a sustained release. And if in fact they meet the criterion, then we would have it back. So it was removed as part of our due diligence.
Madam Chair, it is impossible, and I don't like to use the word impossible, because it's really a big word used by small men who don't understand what they're talking about. I am asking the question, how is it possible for a drug that is a long-term drug, a sustained release product, how could a test, immediate release test be done on that drug, expecting the drug to pass the test, knowing full well that it is a long-term, a long-acting drug? That's my question. What sort of madness could take place that you could actually send a drug and test it as an immediate release product when knowing full well that it's a long-acting drug? So you're expecting the result that you got, a failure of the test. This failure of the drug has cost the government of Barbados over $100,000 a month.
This is a rhetorical question, because I think the director answered there was a mistake.
But
It really was a mistake.
The mistake certainly has cost this government $100,000 a month, and we can start
Take that as
calculating.
comment, yes.
But, pardon me?
Go ahead.
Okay. So I want to know what will we be doing in future to stop this mistake certainly from happening, because this same drug is being used in all other parts of the world. We in Barbados are given information that this drug has failed a test, which certainly it has not. I am saying what can be done in future to stop this from happening, because there's a cost attached to it.
Madam Chair, I think the director of the Barbados Drug Service clearly indicated that the information coming from the manufacturer is what was utilized in the first instance. And it was recognized that certainly that information was not the correct information. So the issue here going forward is for us to ensure, in collaboration with the manufacturers, that the information that we request is the information that they send. So I don't think that there's anything further that can be added by the head of the Barbados Drug Service in this particular case.
Yeah. Madam Chair, if I may, a drug comes with an insert. On the insert of the drug, it marks
I remember
slow-release
that was
test.
asked and answered. I don't think you could beat it anymore.
But they're saying that the manufacturer...
Do you
you're
have
saying-
a supplemental question?
You're saying that the manufacturer of the drug did not indicate. It was put in the insert that is a slow-release product.
Any other supplemental question?
No questions, ma'am.
Thank you. Honorable Member for St. Thomas.
Chair, I wish, ma'am, to commend the Honorable Minister of Health and his staff for some initiatives that have been put in place in relation to the mission-critical aspect of things that we were looking at. And the Honorable Minister would have mentioned some of them. The wellness initiatives, and Barbadians are taking it on. You have too many people who are suffering as a result of the non-communicable diseases, but I know it will take time once we work on our families and our children in the schools and other institutions. So I want to highly commend the team for that. And the plans, ma'am, for the 2 polyclinics to be open, to be able to facilitate others, that it will minimize the numbers that are going to the Queen Elizabeth Hospital for matters that can be dealt with in the more parochial level. And of course, the transfer of those individuals from the hospital who were occupying beds that were for critical purposes for quite a long time. They were said to be persons that were abandoned, but I differ because we see it every day. Many of them have no one to look after them. No family members, they live alone, and of course they were all suffering. And therefore they ended up in the hospital and then could not go back to their home. So I want to commend the minister and his team on that. And the final one will be to do the facilitation of the CARICOM Nationals. I was one of the most astounded old women in Barbados when I heard ever so welcome wait for a call and visitors and families among us who were here 35, 40, 50 years could not get access to medication at the hospital. I know, yes, those living with HIV and so would have been able to get their medication, but I think this is phenomenal because those persons who are living among us are going to be a part of our living. And therefore, when they suffer, we suffer too, because for families to pay for them at private institutions, and so it really has been a burden. So I want to commend that exercise. My question, ma'am, is more so associated with Barbadians living longer. Every other week, there's some centenarian. So longevity is a part of what happens in our culture. And I believe there are only a few countries across the world who would be able to enjoy it. And it's because these are the pillars of our society who live well, act well, maintain their bodies well, despite the fact that they would not have had the access to the health care as we do nowadays. And my question, therefore, ma'am, is what plans does the hospital have, or our health institutions included, for other gerontologists to be given the training and the attention that is necessary if we are to continue to work with these people in Barbados who are living longer. And therefore, I would wish for that question, please, to be answered in the light that I believe, and I'd raise it with the Honorable Minister of Education, that we need for the National Development Scholarships to also focus on gerontologists being brought in to be able to facilitate the needs. But I would like the Honourable Minister, and then just one more to follow, please.
Thank you, Honourable Member for St. Thomas. Earlier, the Honourable Leader of the Opposition had asked about I think he used the word complementarity, Ross University.
Yes.
Right, complementarity. I want to say up front that The University of the West Indies has been the backbone of our health system in terms of the Queen Elizabeth Hospital and so on, and this is a relationship which has been established, which is strong, and long may it continue. However, the influx of medical schools and hopefully other medical initiatives that will come on shore, medical programs, we intend to collaborate with everyone to be able to get the very best for Barbados. One of the areas that we've been speaking to, not only Ross University School of Medicine, but also the American University of Medicine, is in the area of specialization. And not specialization only at the level of physician, but nursing, in nursing. An honorable member, gerontology is one of those areas that we have been speaking to these universities to see how they can assist us with providing the training that you are speaking to, because it is a critical thing going forward, given the fact that Barbados is an aging population. Even the geriatric hospital at St. Michael has about 13 centenarians residing there. And I mean, that alone should tell you. So yes, we are looking at it, and we intend to deal with that.
My final question, ma'am, it is not a tasteful one, but it is a course of an idea of concern, where generally when people die and they have no money, because we still have a large percentage of impoverished people living with us, and with the whole economic situation, it is even making it more difficult. I am concerned that there are so many corpses at the Queen Elizabeth Hospital and another place, and the morgue is bursting at the seams, according to the information I've received. I don't work there, but people complain. And in the light that most of these families cannot bury their own, some because they're worthless and they only want the property, but the body can still let the government bury it, that's the mentality. But the majority, the families are poor, they cannot afford to bury them. I want to find out how the hospital is coping with all those bodies in, or those corpses in the morgue, when so many people are dying every day, and the numbers seem to be growing. I can tell you, ma'am, from the information fed to me, there are approximately 30 bodies between May 2017 and July 2018. And those bodies are still there. I would like to know what plans the hospital has to be able to work with families and others for those bodies to be removed, and perhaps whatever kind of synergies can take place with undertakers and others who may have facilities for freezing and keeping those bodies, to be able to ease the tension at the hospital, because it really relies on that space. And for those families who are willing to work with the hospital and the National Assistance Board and the elderly department, some kind of communication for those bodies to be buried or cremated, but with the families being made aware, because they're persons who would have wanted, we know they had their dignity. And I believe that this is about time. Nobody should be in any institution in the world after a couple of days if you're waiting for postmortems and so on. I would like to know what the hospital plans to do going forward to be able to mitigate that situation that has been a problem for quite some time, as far as I've been made aware. Thank you.
Chair, before the CEO responds, or the chair of the QEH, let me say that yes, I myself recognize that we have a problem here, and I actually requested and received a list from the CEO of the QEH in relation to what the honorable member for St. Thomas just spoke to. And I too, I must admit, I was really alarmed at the numbers. And I had a discussion with the honorable Prime Minister on this matter, because this is one that cuts across ministries. And I can give the assurance that we have started some deliberations on this, and we are in the process of crafting a policy going forward that would deal with this matter, certainly at the national level. So we are aware and we are dealing with it, but I'll hand over to the CEO of the QEH, or indeed the chair.
Thank you, Minister. I think you've really spoken to it, because for the issue of QEH, it's been both an issue of human dignity, that we do have corpses that are unclaimed and remain so for long periods of time, as you described, and this also puts us to costs that can otherwise be deployed to the hospital. So this has been engaging the attention of the minister, because we recognize we needed to have an interministerial approach to this issue, because certainly I think it lends itself well to public-private partnerships. It lends itself well to new policies that allow the public to be aware of what steps will be taken when a person is left unclaimed, and we want to do so in our style of consultation, so that people will understand that we may have to do burials in non-traditional ways, but clearly we are doing all in terms of this approach in the interest of ensuring that people, regardless of their economic and social circumstances, are treated with dignity at this important stage of their journey.
Honorable member for Christchurch West, I'm curious.
Thank you very much, Madam Chair. As some people would be aware, I was a practicing oral surgeon for 27 years, I guess, the better part of my life, in fact, more than half my life. And my profession, my colleagues in the profession would be very upset with me if I didn't ask a question related to that profession. And it has to do with the equipment and facilities that are available for the provision of dental services within the, I think, Sir Winston Scott and the other polyclinics. Clearly, the equipment and facilities are not up to scratch, and they could significantly be improved. And I'm asking the minister, what plans does he have, or does the ministry have, to make significant improvements to the equipment and facilities for the provision of dental services within the ministry?
Thank you, honorable member. Thank you for the question. Of course, we have problems with equipment and facilities that are not only restricted to neurosurgery, but this is throughout the healthcare system. We have an aging plant, we have outdated equipment, but we are dealing with a situation where we have to create the right mix between what we can afford, what we would like to have, and what we must have. And that is a reality. In my view, before we could look at the question of replacing equipment at the polyclinics, we have to look at the question of or the challenge that we face in terms of the human resource capacity, because as it is right now, we do not have the capacity to do what we want, and that is the major focus at the moment, trying to rebuild the capacity to be able to deliver the service. And let me say to you that not that we're neglecting the whole question of equipment. We have to look at equipment, but we have to look at equipment holistically, not only at the polyclinics, at the QEH, and there's some decisions that we have to make in terms of how we are going to proceed, because it is costly, but at the same time, we cannot have champagne taste if we have Moabi pockets.
Yes, thank you, Madam Chair. So I have a follow-up question. I appreciate that, but I also aware that this ministry gets, I think, the second highest vote of all of government's resources. I think the highest is education. So I wouldn't consider that Moabi money. I think that is significant money in consideration of the budget of the whole government. But I do take the point, because I know equipment is expensive and difficult. But you did touch on an important point, as it has to do with the human resource. And I am aware that there's a problem with the dental auxiliaries, because I understand that the program that they used to do in Jamaica is no longer offered, so therefore you're having great difficulty filling posts for dental auxiliaries, and then by extension it's causing significant wait times at the polyclinics for the provision of dental services. So therefore, I'm asking what actions or what policies are you going to be pursuing to be able to replace those dental auxiliaries as they eventually retire and come over the service? Because then that would give a significant gap in the ability to provide the dental services that the people of Barbados are now accustomed.
The Honourable Member for Christchurch West, as I indicated earlier, yes, this is a problem. One of the ways that we are looking to deal with it is discussions that we are having, like I said, with some of our newfound partners. And I can tell you that we are having deliberations with an entity. I can't go into the details, but we are looking at having a dental school established in Barbados as part of the government's quest for making Barbados a health center or a hub for medical education and medical services. That is part of that entire process. But I want to go back to what you were saying. Sorry, the other part of it is that we also have to look at and to see what we can outsource or how we can involve or expand the services with the private sector to see what we can do in that regard as a short-term measure. But of course, we want to get ourselves back to the levels that we were before so that we can do what was done in the past. In other words, to be able to be more effective in the delivery of dental services in this country. But when I made a statement about the Marby pockets and so on, I wasn't joking about that. Yes, we received the second largest part of the national budget, but when you have a staff of about 4,000 persons in the entire health sector, and you have all of the institutions that I outlined earlier in my introductory remarks, when you have chronic diseases, the NCD is increasing at the rate that they are increasing, when we are paying about $25 million for dialysis treatments alone, and you continue with that, you can see that what may look like a large part of the national budget is not large enough, especially when, if we look at the standards established by WHO for health service funding and the health spend of a nation, and we are still not up to that level as yet, in spite of the amount of money that the successive governments have invested in health. So that going forward, as I said earlier, and I need to reiterate this point, is that the emphasis has to be once again on primary health care. Preventative responses has to be the thing going forward, rather than the curative effort that is required if we don't do what we need to do at the primary level.
I must say, though, that I consider dental health care to be a primary health problem, because in truth, and the doctors in here know I'm talking about, a lot of the diseases are discovered by dentists that we deal with. A lot of things come from dental diseases that affect on the medical side. So I think it's well worth it if we consider primary dental care as part of the primary care. This is just my opinion.
But we do, and that service is still being provided within the polyclinic system, within the primary health care system. Is not at the level that it was before, because we have those human resource constraints. And like I said, dealing with the human resource side of it is going to take some time. Even the training that is required for a dental auxiliary takes about 4 years, for example, and it's expensive. But we have to go there. But in the interim, we need to invite the private sector in to see what we can outsource and how best we can do at this point in time, at present, in order to be able to deal with what is a serious problem, and I agree with you that it is.
Okay. Final question? Okay. Honourable Member for St. Michael West Central.
Thank you. Minister, and to your team, I want to, and particularly the professionals at the Queen Elizabeth Hospital, I'd like to congratulate all those who serve in our very best interests. And I must tell you that I since May last year, you can almost notice the stabilization of services at the Queen Elizabeth Hospital. And I want to compliment you on the path going forward. I note that in the estimates approved, not by this government, but by the last administration, had made provision for 145 million. We, since coming to office, would have added another $5 million to improve the services at the Queen Elizabeth Hospital. And we can see how well that money is being spent because of the stabilization I spoke to and the growth. The budgeted estimate for 2019-20 would have showed 129.5 million. I am aware that through the budget presentation that there is going to be the health service contribution levy, which I presume, and I'm going to guesstimate, probably give you another maybe $40 million. So in total, you're going to be funding the hospital, I think, by over $169.5 million. You can go to the extreme if you had 50, but I'm going to be conservative at 40 million. Now, this is perhaps the large average expenditure, say, within the last, within a 5-year period, and I went back to the estimates of 2009 right through to 2014. So, Minister, I really would like to ask of you in the Queen Elizabeth Hospital, considering the increased expansion in funding and resources, what plans do you have for the Queen Elizabeth Hospital in respect of capital expenditure in particular? Because I know we have issues with operating theaters, the wards, etc. So if you could elaborate on the plans that you have for the Queen Elizabeth Hospital given the expansion of income.
Thank you, Madam Chair. In reviewing the investment at the Queen Elizabeth Hospital, we've noted that $129.5 million will be provided to the QEH, $3.07 million for the emergency ambulance services. We estimate at least another $40 million coming from the health levy. We generate an additional $8 million from private revenues, that is, doctors who bring patients into the hospital. We generate an additional $8 million. And then we intend to raise another $1 million from other sources of revenue. It's important to put on record in the Honorable House that after our board has spent quite a lot of time trying to wrestle along some of the inefficiencies, the procurement issues that the chair spoke to earlier on, the run rate at the Queen Elizabeth Hospital today, as of January 31st, is $16.3 million per month. Salaries comprise of $10 million, medical supplies of $1.1 million per month, drugs $1.2 million, food about $200,000, utilities about $700,000, maintenance of the aging plant about $400,000, and we outsource selected services such as MRIs for about $300,000 per month. We've set ourselves a number of programs for 2019-2020. First of all is the continued improvement in the fiscal performance of the hospital. As you know, we've adopted the program budgeting philosophy, and therefore we're in a position now to disaggregate the budget across a number of programs and then hold respective heads accountable. We intend to, in keeping with the Minister's trust on wellness, we intend to expand our screening programs. We have the view that we're not screening enough in Barbados, and therefore we have 3 major screening initiatives to be implemented. Telemedicine is well developed within the Queen Elizabeth Hospital, and we're currently partnering with Digicel Cisco to launch a tele-ophthalmology project where the Queen Elizabeth Hospital is seen as the node, and we could screen patients for diabetic retinopathy and glaucoma. Once that project gets going, it is our intention to replicate it across the hospital, across the polyclinics, and therefore reduce the burden of screening within the Queen Elizabeth Hospital and allow us to do a lot more primary care. The vision for this is, just conceive we're able to set up nodes in some of the smaller islands, And through technology, we are able now to do screening from within the Queen Elizabeth Hospital and thereby generate a revenue for the eye department. So screening for eyes is one of the big programs for us. The second major program would be colon cancer care. We believe that colon cancer is a treatable disease. There should be no reason why today citizens should be dying of colon cancer. And therefore, we're going to launch, in collaboration with an NGO, an aggressive colon cancer screening program where patients can book an appointment, come into the hospital, have your CT colonography done, and if we find any nodes, then we send you on to the gastroenterology unit to have those nodes removed. Colon cancer today is the second leading cause of cancers in both men, male and female, and we really believe that this is something that we could aggressively wrestle down and remove it from one of the top 5 cancers in Barbados.
Sorry, sir. It's all well and good with the screening. I can't help but talk. I apologize. It's all well and good with the screening, but what about the equipment in the oncology department for treatment? Is that going to be upgraded in the near future?
Well, this colon cancer screening...
I'm extrapolating to breast cancer and other cancers, for instance, and treatment to avoid patients having to go overseas for treatment.
Right. Madam Chair, the current infrastructure we have for cancer care at the Queen Elizabeth Hospital is one in which we could take care of at least 95% of the cancers that we have in the country. Prostate, colon, cancer of the cervix, uterine cancer. We don't only have the capacity, but we also have the human resource capability to address it as well.
So your cobalt unit is satisfactory compared to the rest of the world?
Certainly cancer care, we could do better. The gold standard is the linear accelerator, as most would recommend, but this is a very expensive piece of equipment that requires a lot more maintenance and setup and setup cost. So in the event where patients require cancer care that is outside of our remit, then we have treatment sites that we could refer those patients to. But for the majority of the cancers that we have here in Barbados, we can manage them and manage them well. We've just recently had one of our junior doctors return from China, and they spent 6 months there improving the whole question of breast cancers. And that is an area where we've built capacity to manage that form of cancer. The third area that we would like to expand our screening program is in the point-of-care testing for patients with renal problems. The Minister alluded to the fact that patients presenting with chronic renal problems is a big issue for us. We manage today close to 350 patients on hemodialysis that consume close to $18+ million. So our nephrologist we've discussed it, and our view is to use point-of-care testing to go throughout our communities and begin to test patients whose renal functions may be impaired. If we're able to find those patients early, in collaboration with our polyclinics, these patients now would be managed at the polyclinics. Essentially what we're trying to do is to delay the onset that these patients may have on the Queen Elizabeth Hospital in terms of hemodialysis treatments, which is very, very expensive. So a major part of our program this year, apart from sustaining the existing package we currently provide to the Barbadian public, is to expand our screening programs as part of the primary care and wellness program of the Ministry of Health.
I have a follow-up question, 2 follow-up questions, Madam Chair. The issue of the facilitation of donations to the Queen Elizabeth Hospital. I know of one other Caribbean country, Jamaica to be exact, where they benefit substantially from the facilitation of donations. And I'm wondering, because I am aware that there are several entities, particularly in the Florida region especially, who are willing, and other Barbadian organizations abroad, who are willing to make substantial contributions. But often they complain whenever I'm traveling or when I visit people in Barbados, they complain about the facilitation process. Can you elaborate? Can you tell us any objectives, ideas, Minister, I don't know, through your Queen Elizabeth Hospital, that you have, or new initiatives that you intend to introduce to facilitate the ease of donations to the Ministry of Health or the Queen Elizabeth Hospital?
Thank you very much. Thank you, Honorable Member for St. Michael West Central. I want to just briefly respond to the earlier question on the CEO would have emphasized important work on prevention that the hospital is doing, but I wanted to specifically answer your question about what are our specific plans in relation to the additional income that's going to be coming from the health levy that's being collected by the institution that you have the honor to chair. We really decided, and much in the way that the government has really devised a way for prioritizing its call on national expenditure. You'll recall we're going to do what is in the interest of safety and security. Next, we're going to go to health and so on and so forth. We've done a similar thing as a board of management. We've decided what we're going to focus on what we call the pain or pressure points that are most impacting the public of Barbados. And as a result, we recognize that waiting time in the accident and emergency room have been a challenge, so we're prioritizing the equipment needed to expand the new facility that we're building, so plant and equipment in that regard. We recognize also that waiting times for surgeries, people being brought up to surgery 3 or 4 times and having to be sent back is extremely disconcerting and also deeply inefficient. So we're working on issues around strengthening our central sterilization unit, increasing our surgical and other equipment associated with our ability to turn surgeries around more quickly. In relation to, we also have some inefficiencies around patients who are remaining in beds and taking a long time to be discharged from the hospital because our time to get them to the diagnostics that are within the hospital are impacted by breakdowns. So we are really looking at strengthening our preventative maintenance and increasing the uptime of equipment that exists within the hospital. And now to answer your question specifically on the area of strategic philanthropy, we recognize that this is an area that has tremendous potential for the hospital. In most hospitals globally, as you've identified, strategic philanthropy is big business. So we recognize that we can no longer treat this as an adjunct or an area that doesn't need strategic focus. And we've been working in close partnership with first of all, with the Ministry of Foreign Affairs and the Consul General for New York. And we've gone into the diaspora. We've met with a group of donors under the auspices of the Consul General to New York, getting a better sense of what are the issues and experiences that people have when they're seeking to bring equipment. We wanted to work both ways. We wanted to help them understand what our strategic needs are, and we then wanted to explain to them what our strategic focus is as a board. Certainly what we've identified that there's a need for a person on the board to be responsible for philanthropy and to really keep that in focus, and we've identified one of our board members, Joseph Leflouf, to be our key person looking at these kinds of investment so they don't get lost in translation and people have a person that they can hold accountable for ensuring that these matters are addressed. We also recognize it has to be a staff function that is identified within the hospital that is following up on and ensuring issues such as customs, issues such as coordinating with Ministry of Health and other partners are dealt with efficiently in order for the donations to come through. So I wanted to give you the assurance that as a board, we recognize that we had to treat with this issue very carefully because we see it as a strategic pillar in our ability to raise resources. In the last 6 years, we've raised $12 million, and under our administration alone, we have, in this financial year, we've obtained $150 million from the Rotary Club and other benefactors who've been very, very generous to us. So we want to ensure it continues to be strategically focused on our priority areas of need.
And thank you for that.
Madam Chair, sorry, I think I need to say at this stage that this philanthropy, the philanthropic exercise is not restricted only to the Queen Elizabeth Hospital. And let me make it very clear that the Ministry of Health and Wellness has established a facilitation mechanism to deal with the entire health system because it has to reach the level of polyclinics and of much needed district hospitals.
Yes, and thank you for the explanation, because going through my mind and the reason for asking the earlier question had to do with the fact that if you are running a hospital annual monthly operating costs of about $16.3 million, and then when I look at the estimates based on your other revenues, I think any philanthropic donations can help you to bridge the gap if necessary. But to the last question, Minister, I note that the Barbados Defense Force has been doing a lot of what you might call it, civic community, or making substantial investments in the community. For example, I've seen at the geriatric hospital the works undertaken by the discipline force, and I'm wondering if you could tell us if there are any plans that you have for involving perhaps the Defense Force or any other organization in assisting the other areas within your ministry, other polyclinics, geriatric hospitals, and or the Queen Elizabeth Hospital in an attempt to assist with the building maintenance program, because those of us who have known the geriatric hospital before and after that exercise, I think would conclude that the Barbados Defense Force did an outstanding job there. So my question to you, do you have similar plans for any of the other organizations, units within your ministry?
Yes, thank you. Let me say that the work that is being done by the Barbados Defense Force will continue at the geriatric or the St. Michael District Hospital, and the intent is for that to also be done at the other district hospitals. We also have work to be done at polyclinics, but it is not the BDF alone that the ministry intends to target. I believe that we need to establish some partnerships, for example, with the folks at the Samuel Chapman Prescott Institute, and also the training board, the vocational training board, to see what resources that we can utilize from those institutions that are obviously benefiting from contributions by the same government, to be able to help us along with contributions from the private sector and other Barbadians who would like to donate, so that we can address the issues at the other healthcare facilities. It is intended, for example, if you want to take St. Lucie District Hospital, if we mobilize the business people within the area of St. Lucie, within the parish of St. Lucie, to make contributions in that regard. Also, groups, community groups, and even with the 2020 program that the 2020 initiative, Vision 2020, it is my belief, and I plan to approach the persons who are behind that effort so that the diaspora, as they visit, that they can make contributions and donations in kind, cash, or equipment, whatever, to adopt a healthcare facility within the parish when they come in. So this is the way that we are going to be going in terms of trying to address the issue of the aging health plan.
Thank you.
Minister, certainly the Ministry of Health and the health of all Barbadians and those other persons who live here, I must say, can only be concluded by, I will only conclude by saying that the health is in very safe hands with your leadership. Thank you, sir.
Honorable members for St. Michael East.
I'm glad to hear this
some small parts of a reform program coming out of the Ministry of Health. But I think that we have a fundamental problem that need to be resolved. We boast about, as a consequence of the development of health and science and technology, we've been able to have an aging population. When that population reaches a certain stage, many of them, some that are sick, some that are not sick, normally ends up in the arms house, what you call the district hospital, because I know a lot of discussions excluded that particular hospital. That hospital is seen, I don't believe it should be called that, but that is seen as a point of transition to the Westbury Cemetery. Senior citizens hold great fear, not only at the stigmatization of it being called an arms house, but also great fear because they believe that they're going to an arms house or hospital, which I'm not sure if that name is the most appropriate name for modern thinkers to put on an institution of that kind. I even tell you this, that I have seen some studies call it the point of last refuge. Some of those persons are not sick people, yet the institution is called a hospital. I believe that you need to work in close collaboration with the National Assistance Board so that we can find some common ground to find a more humane approach to how we treat to our people when they reach a certain age. That was all right when we were in the backwoods as human beings. And I don't mean our people alone. I'm talking about all back in the Stone Age. But I believe that in modern thinking, we ought to take into consideration at least more humane terms and at least find a way. I mean, even the image of the hospital, so-called hospital there, is not really suited, not even for physical or recreational purposes for senior citizens who are aging. But I hope that the Ministry of Health understand the kind of psychological damage that is done to our people. And I hope that you address that issue, sir.
Thank you, Honourable Member. First of all, with all due respects to the Honourable Member, but I would have to object in the strongest terms possible for the use of the term arms house with the St. Michael District Hospital, which is a hospital that is providing excellent service to the elderly in this country. And that is why there are 13 centenarians there. They have specialists and specialized care with well-trained staff who are working day in and day out on behalf of the seniors in this country. It is not the last place of resort or on the way out. I have found in the system people who have been residing at those hospitals for 30, 40, and even 50 years. What is required, Honourable Member, is for a palliative care facility that would take some of the strain off of the hospitals, the district hospitals. And contrary to what the Honourable Member may be thinking, we have a waiting list of persons who want to get into those hospitals that would make your head grow. In fact, the demand for the use of the hospitals have outgrown what we are able to facilitate. So I really have to object to that, but I can assure the Honourable Member that we will continue the process of trying, and I agree that the plan is not really satisfactory, and the ministry has been operating with limited funds, but we will continue the innovative way of doing things, and I give the assurance that we will tackle the district hospitals one by one, and we will bring them up to a state where Barbadians can be proud of the way they look.
Minister, probably is my poor understanding of the English language that I was unable to construct my position in a logical way. But what I wanted to say, since I did not say it the way that others think it should have been said, I'm saying that that
entity has been classified as an armed source for a considerable time. And I agree that to some extent the word is not that commonly used now as it used to be used before. But I'm going a little further by saying if these people are not sick people, then the institution should not be called a hospital. And a more modern term, and I was discussing with one of my colleagues, he said even if you call it the Beckersville home, senior citizens home, or anything like that, even if the legislation don't fully give clarity to that, people would feel much better believing that they're going to a stay-at-home that will cater to them than believing when they get through those doors that is the point of no return, and that is called a hospital. And you're not suitable for the Queen Elizabeth Hospital, so you say to the director hospital, you're graduating close to becoming a deceased.
Honorable member, the St. Michael District Hospital has an elderly daycare program that is very much sought after by the elderly in this country. I would say to you, honorable member, that I had the pleasure of being present when Her Excellency, the Governor General, visited the district hospital at St. Michael. And there were elderly people there who, people were reading poems to the Governor General without glasses, including a centenarian. The intellect that was coming, the level of intellect that was being displayed by those persons, you would be amazed. And so I cannot agree in the way that you are characterizing the institution, but I do agree that there are quite a few people there who ought to be elsewhere in some sort of, in another program, and I believe that the Ministry of Elder Affairs and the Ministry of Health and Wellness, that this is, and we have had this discussion, we have to have a few sessions to deal with this issue to see how we can separate elderly care really from medical care for the elderly, because they're two different things. At the moment, the hospitals are serving as everything. I would go further to say that I believe the time has come in this country with the aging population, and for the reasons outlined by the honorable member, where we as a nation have to look, and especially the private sector, because I think this is an area that they need to get into. Elderly daycare is a critical requirement in Barbados right now. And this would deal with a lot of the issues that we are currently experiencing and the issues that were outlined by the honorable member.
Thank you. For my own knowledge, I know the daycare facilities had activities, craft, and so on. Did that ever spill over to the general population in the geriatric hospital, where they could get physical activity and so on? That used to depress me. Has it spilled over?
Certainly from the time that I have been the Minister of Health, I have not seen that generally in the other districts. St. Michael, yes, but it is something that we need to look at in terms of the entire spectrum of district hospitals.
Thank you. Yes.
I just want to let the Minister know that I am not indicting him in any way, that I have absolute confidence not only in his wisdom and his ability to do things, but I also know he's a very compassionate human being. So I am expecting that you would do everything that you can to make the positive changes so that we can make our society much better than it is. Thank you very much.
Madam Chair, the honourable member, he would never be indicted. I know that, but at the same time, I think it is my responsibility, my duty, to really represent the hard-working people within the district hospitals, providing excellent care to Barbadians.
Yeah, you're an army man, you could take it. Honourable member for St. George South.
Thank you, Madam Chair. Thank you.
Thank you, Madam Chair. Indeed, I want to begin by congratulating the Minister and his team for coming here this afternoon and displaying a level of knowledge, sound knowledge about all areas, the subject areas of health and wellness. And I think that the record needs to reflect that. But two things, Madam Chair, and my first question will be directed to the chairman of the QEH, and I hope this afternoon I will still have a meal when I leave these chambers. I heard the chairman of the QEH mention donor funding of some $150 million. I'm not sure whether that is correct, but if it's so, I want to congratulate the QEH. Indeed, that is a very remarkable, and the chairman, for indeed raising within a short space of time $150 million. But I want to go further, Madam Chair, because I'm not comfortable listening to both the CEO and the chairman of the QEH that indeed they have a good grasp and sound handle, or a good handle of the preventative and predictive maintenance challenges at the QEH. And why I'm saying that, some time ago, years ago, I sat where the member for St. Michael Northwest is sitting, and I had the opportunity to shadow this ministry. It was then the Ministry of Health, and now it's Health and Wellness. And there were some areas, Madam Chair, that bothered the opposition at the time. And I can call a few of these areas that I noted here. The week after week, operating theater down. Week after week, dialysis machine out of operation, patients turned back, some from St. George South, and I know they're listening because one sent me a note here via WhatsApp earlier. Elevator down, blackouts. I would like the chairman and the CEO of the QEH to tell the Lord Chamber, and indeed the public, because for me, patient care goes beyond these fancy and flowery words, but patient care, the heart of patient care is equipment operation and equipment uptime and not downtime. So I would like the management, the CEO and all the chairman and or to tell the Lord Chamber what are some of the measures that have been put in place of recent to alleviate the challenges as it relates to equipment and plant.
Okay, thank you.
Madam Chair, I just want to let this chamber know that I've worked 20 years as a maintenance engineer and an operations manager. I was not prepped at home.
Thanks for that information.
Honorable Madam Chair, thank you to the honorable member for St. George South for asking this question because it is an important question based on how we're structuring the finances of the hospital. It's important to note that since 2009, there's not been any significant investment in plant and equipment in the Queen Elizabeth Hospital since the electrical upgrade project. And that is important to note because you could imagine between now and then the state of affairs as far as plant and equipment are concerned at the hospital. So when we arrived in June 2018, we met a demand from the engineering team of the hospital and the clinical staff at equipment, plant and equipment needs of the hospital standing at $66 million. And this demand for plant and equipment grows every single day. with breakdowns, as the member for St. George South has pointed out, the challenges associated with not being able to maintain a preventative maintenance program and a predictive maintenance program. So what we had to do as a board is immediately work with the Director of Engineering Services, and I must commend her and the department, and the clinical staff at the hospital, at working with Mr. Andrew Niles, Joseph Lafloof, and other members of the board to develop a clear sense of prioritization of what the equipment, building and equipment needs were, based on that list that we were given of 66,000. We recognize that I would have spoken to earlier that we could get some items through pursuing a strategic philanthropy approach. But more importantly, I think the government's decision to invest in the creation of the health levy is intended to go a long way towards ensuring that we have the kinds of resources. And what we're seeking to do with the health levy is, as we receive that levy on a month-to-month basis, really secure between 10 to 15% of the resources that come through that levy source towards creation of a capital fund, so that we're in a position to start more effectively planning how we're going to roll out our maintenance programming and deal with any critical breakdowns that have the potential to endanger patient care significantly. We also recognize that the issue of technology needs to be dealt with in terms of how technology is selected for the hospital. So we're intending on looking and working with the Pan American Health Organization at doing technology assessments to ensure that we're utilizing the right technology in the right places to provide us with that we can afford to maintain over the tenure of the hospital. We also recognize that there are people who are maintaining the equipment at the hospital, specifically the biomedical department. I can think of the maintenance section of the hospital, who in many instances are working under very, very poor conditions of work. The conditions of the biomedical department are seriously an occupational hazard. So we recognize, in order to get the best out of our staff, based on our philosophical commitment of ensuring that staff are provided with the necessary equipment, we will be looking to improve the facilities for our engineering department staff to be able to work on this so that they can deliver the kind of services in biomedical and the other areas of the hospital. So I wanted to give the honorable member for St. George South the assurance that as a hospital, we recognize the area of preventative maintenance being a priority, and as a result, we've earmarked it for resources from the health levy, and we will be rolling out a program specifically targeting our biomedical equipment. CEO?
Just to expand on our chair, there are several initiatives we have to maintain the robustness of the plan. First of all, I'd like to just share with you that we have about 5,000 pieces of biomedical equipment and about 4,000 pieces of non-medical equipment. So that gives you a sense of the enormity of the preventive maintenance program. We have used technology. We have a software called Info-EM, and all our equipment, all our biomedical and non-medical equipment are in fact on that piece of software that gives us information on the timeliness of preventative maintenance. We do in fact monitor uptime of the plant. An uptime report goes to the board every month to give a sense of the state of good repair of our equipment. We have routine maintenance that takes place daily for dialysis machines or operating rooms, and these types of maintenance takes place after hours. We have scheduled maintenance on selected periods of time, whether the machine has done a certain number of hours, and this is based on dedicated preventative maintenance contracts that we have for selected pieces of equipment. As the chair indicated, we now have a dedicated budget targeted for preventative maintenance. So we should see a higher level of uptime of our existing plant. And then finally, through philanthropy, we hope to set up a sinking fund so that donors who make contributions specifically for the equipment purchases, we would put aside some of those funds into a sinking fund, which will be dedicated towards not only planned replacement of equipment, but also to ensure that we could carry out routine maintenance as and when required.
Madam Chair, I beg to move that you do now report progress to His Honor the Speaker and ask for leave to sit again.
The question is that I do now report to the Honourable Speaker progress and ask for leave to sit again. All honourable members in favour, please say aye. All honourable members against, please say nay. Methinks the ayes have it.
The chairman of the committee has reported progress and I humbly requested leave to sit again.
Speaker, recommittal of government notices.
Honourable member St. James North.
Mr. Speaker, I give notice of the following bills. The Value Added Tax Amendment Bill 2019, the Securities Amendment and Validation of Fees Bill 2019, the Shipping Incentives Amendment Bill 2019, and the Caribbean Community Amendment Bill 2019. I also give notice of a resolution to grant the sum of $1,794,868 from the Consolidated Fund to be placed at the disposal of the government to supplement the 2018-2019 estimates.
Recommittal of first readings of bills.
Your Honor, I move that the following bills be read for a first time. The Value Added Tax Amendment Bill 2019, the Securities Amendment and Validation of Fees Bill 2019, the Shipping Incentives Amendment Bill 2019, and the Caribbean Community Amendment Bill 2019.
The question is that the aforementioned bills be read a first time. All those honorable members in favor, please say aye. Those against, please say no. Me think the ayes have it.
Pedro.
Government business.
Yeah. Your Honor, that brings us to the end of government business for the day. I therefore beg to move that this sitting be suspended for resumption on Friday, the 1st of March, 2019 at 10 o'clock in the morning.
The question is that this honorable chamber be suspended on the first day of March 2019 at 10 a.m. in the forenoon. All those honorable members in favor, please say aye. Those against, please say no. We think the ayes have it. This honorable chamber is suspended until the 1st of March 2019 at 10 a.m. in the forenoon.
Friday. 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 I said 1st of March. Yeah. Friday the 1st. Friday the 1st. Yeah. Friday the 1st. Yeah.